Hi, I'm Dr. John Nasser, President and Chief Medical Officer of Optum Tri-State. Welcome to Krista Run Healthcare. In 1996, we started as a small multi-specialty group medical practice. With a steady focus on meeting the needs of our community and the delivery of value-based care, Krista Run has now grown to include a dozen state-of-the-art locations in 3 counties with more than 50 specialties and 375 plus world-class physicians and advanced care practitioners. We serve over 350,000 patients throughout New York State's beautiful Hudson Valley and Lower Catskill region. As a physician-led organization, we're proud of the progress we've achieved and our ability to offer patient-centered, academic quality medical care in a community-based setting. Now, as part of Optum, we're excited to have the support we need to bring together brilliant minds and leading-edge technology with a focus on growth, innovation, patient care, and supporting our providers in doing their life's best work. Today, I welcome you to experience an in-depth look at Krista Run Healthcare through the lens of some of our physicians and APCs. They'll share some of their experiences and talk about our commitment to creating an atmosphere that is inclusive, empowering, and rewarding.
So when I came here, I was the second family physician, and our growth has just been exponential since then. The opportunities for physicians and APCs are endless. So medicine is hard. A lot of graduates come out with great training academically. They know what they want to do, but medicine isn't cookie cutter. It's not very smooth. They need a lot of support, and that's something I always found here at Krista Run. I sometimes like to think of Krista Run as a large fellowship where the support team is there, the specialists are there, and everyone is backing each other up as they need further support. And the nice thing about Krista Run is it's highly flexible, so you can design the kind of career and the kind of practice of medicine that you want to do. Whether it's joining our leadership team, whether it's practicing purely clinical medicine and redefining the scope of the type of patients you want to see, you can pick and choose, and the practice will meld and be flexible around you.
I joined Krista Run Healthcare about a year ago, and the main thing that I was looking for was to be at a place that I can continue to learn, and I felt that Krista Run was exactly where I wanted to be for that. Coming out of residency is scary, and you are kind of by yourself as a solo practitioner. The collaboration with other physicians as well as other surgeons in the practice really gave me the tools that I needed to help make my practice better. One of the things that led me to choose the specialty was limb salvage. I kind of saw firsthand what my dad went through as a diabetic patient, and to be able to practice limb salvage procedures really does mean the world to me. Here at Krista Run, I can collaborate with other specialties that's necessary for proximal limb salvage procedures. Knowing that my colleagues and I are here to do the right thing for a patient, I don't think that you can put a price on that.
I've always felt really appreciated as a mid-level. Coming up through training, I was in a lot of different hospitals and environments, and there was different attitudes towards different level of providers. From the moment I started my clinical rotations at Krista Run, I was really welcomed as a physician assistant. Always felt like I was going to be part of the team, and was a huge draw of why I picked Krista Run. So I can't imagine working at a different facility than Krista Run Healthcare, specifically urgent care, where we have stat access to advanced imaging, not just X-ray, but CAT scan, MRI, ultrasound. It's amazing that within moments, I can reach out to any specialty with multiple providers that are willing to help. For me as a provider, it's just knowing that I've absolutely provided the best care in a timely manner to my patients. And for our patients, I know that they're safe, and I know that they're taken care of. Another amazing thing that Krista Run Healthcare has done for me is they didn't let me stay stagnant as a provider. When I came to them and showed interest that I wanted to broaden my role and my skills and really had an interest in teaching, they worked with me in my schedule so that I could become an adjunct professor for a local physician assistant program. Krista Run has always been super kind and generous to me as a mom with a family, and they've been always willing to help me with my schedule and help me with all of life's important moments, making sure that I can work and enjoy those moments.
At Krista Run Healthcare, collaboration and innovation is at the heart of what we do. Krista Run Healthcare was a good fit for me coming out of fellowship because it was and continues to be a well-established large cardiology group within a large multi-specialty healthcare providing system. Crystal Run Healthcare has grown tremendously in the number of years I have been here, not only within cardiology, but within all specialties. And within electrophysiology, the field is changing very rapidly with new types of procedures and technologies, and the electrophysiology team makes a priority to stay well informed of the latest technologies and types of procedures. Crystal Run Healthcare provides a lot of support, both in time away from the office as well as financial support, continued medical education. So there are lots of conferences and seminars that I and other physicians take advantage of, and they are crucial to continuing to provide excellent care for our patients.
Coming out of fellowship, I was looking for an ideal place to start practicing medicine. What I loved about Crystal Run Healthcare not only was the fact that I had other rheumatologists to work with, but I had a whole team of doctors that I was able to work with. We really house majority of the medicine specialties and surgical subspecialties under one roof, so our patients can get all the type of care that they need. So if there was ever a situation where I was not going to be in the office, or if I needed to be away for a few days, I know my patients are being taken care of by my colleagues and my staff. And that type of support not only feels like it's empowering to me as a physician, but also will allow for better care for my patients as well. What makes me feel most fulfilled as a physician, along with providing great patient care, is also making sure that I have a great work-life balance. I mean, the Hudson Valley has everything to offer. I mean, not only do we get 4 beautiful seasons, we have fantastic clean air, access to mountains, lakes, beaches, but also we are in such close proximity to New York City and all the major airports. And as someone that really loves to travel, that is one of the most important factors to me when deciding where to practice. When I was first doing my interview, what was the most striking was the vibe. Truly, I felt a cordiality between my colleagues. I felt love and enthusiasm from my staff, and that initial feeling that you get when you're walking into a place, you have to hold on to that, because that is your gut instinct telling you that this is going to be home for you.
Crystal Run Healthcare is more than just the preeminent healthcare organization in New York's Hudson Valley and Catskill region. It's a place where you will greatly improve the life and health of others, where you will have countless opportunities to grow and develop personally and professionally, and you will be a valued member of a diverse and high caliber team. Most importantly, you will find and be a part of a wonderful professional family. So come join us. Learn more and apply now so we can all continue caring, connecting, and growing together.